Morning, Palau. I am Dr. Vijayananda Sundara. I am from India. I am working for the Ministry of Health and Human Services since the past 5 years. We are here to talk about diabetes as a part of celebration for the World Diabetes Day on November 14th. And the theme for this year is access to diabetes education under a broader theme of diabetes, access to diabetes care. We have a nurse here, Minda Benjamin, who is an NCD nurse dealing with a lot of diabetes patients on a day-to-day basis. And we have our healthy eating promotion officer, Ms. Dorcas. And then we have Brinn Demei from Ministry of Education, who is promoting healthy eating at the schools as a breakfast and a lunch program. Okay, we are here to discuss about diabetes. What are the types of diabetes we encounter in Palau? Palau has a high risk of diabetes. Just by being a Pacific Islander, your risk for diabetes will increase. So it is important for all of us to know about this topic. We have three kinds of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes means that your body cannot make enough insulin, so you have a risk of having a high sugars. Insulin is the key that will open the gate for the glucose to enter your cell. Because you don't have enough insulin, the glucose is not entering into your cell, though you have high sugars, and it will not be utilized. This is going to make you weak, make you feel tired because your body is not getting enough energy. Type 2 diabetes means that you were producing enough insulin way back, but now your cells have developed insulin resistance. That means your cells no longer accept insulin, and then the glucose is not being available to your cells. Gestational diabetes means that you have a diabetes because you're pregnant, the different hormones of the pregnancy are making you to have a diabetes. Okay. And then what are the symptoms of diabetes 2? Type 2. We have a high risk of type 2 diabetes in Palau, and the patients are as young as 12 years old with type 2 diabetes. So we are here particularly to talk about type 2 diabetes. Your symptoms could be you have a difficulty to pee. You have high frequency to pee. You pee a lot. You feel thirsty always because you pee a lot. You feel very hungry. You feel tired because your body is not getting enough glucose. And you feel numbness and tingling of your hands and feet because your nerves are not getting enough glucose. Always you have dry skin, and whatever infection you get, like a sore or anything, it takes a long time to heal because the healing process is slowed because not having enough glucose to the cells. Your body has high level of glucose, but it is made unavailable to the cells. It's like you being in a sea but unable to drink water because it's salty water. So it's like you have a high level of sugar in your body, but that is not available to the cells to function normally. That's when you have type 2 diabetes because of insulin resistance. It will take years to develop, and our healthy lifestyle is the one which can actually prolong the time from which it develops. Okay, it usually starts when you're adult, but the symptoms will be shown when you're more than 35 or 40 years old. And what are the risk factors for type 2 diabetes? The risk factors are if you have a pre-diabetes. When we say pre-diabetes, it's like you are borderline. That's what most doctors might have told you. Like your HbA1c is little bit above the normal, but you're not at to the position that you have to take medication yet. Your body can still function. Being overweight. What means to be overweight is your height and your weight does not match, and your BMI is more than 25. And if you're 45 years or older, you are a risk factor for having a diabetes. Having a sibling or a parent with a diabetes also puts you at risk for diabetes. If you are physically active for less than 3 times a day, that also will be a risk factor for your diabetes. Having had a gestational diabetes when you were pregnant, or if you had a big baby which is more than 9 pounds or more, puts you at a risk for the diabetes. And if you are a Pacific Islander, it just puts you at a risk for diabetes. Okay, and then we have many access cares for this diabetes. Like we have a pre-diabetes screening program through community outreach and even at worksite outreach. There is diabetes testing through health checkups. You can participate in physical activities like HIIT or Zumba or swimming. And there is a special diabetes prevention lifestyle change program that you can be in if you have any of these risk factors. And then how to get, if you are checked up, you can come to the hospital or any community healthy centers. If your fasting is more than 105 but less than 126, you're still a pre-diabetic. That means you're on the borderline. But if your fasting is greater than 126 in the morning after not eating for 8 hours, you're already a diabetic. You have a diabetes diagnosis by, you can make your own goals, have medication and have diet to bring down the complications of your diabetes. I think that's it. We have food handlers, Dorcas. You want
so ngal dokta nga misa dala se nganya kaldel badengela asukal nganya type 1 diabetes. Type 1 diabetes the el en talmala abadengela via produce insulin. Maganda mo spare insulin for life say type 1 diabetes. Type 2 diabetes asel insulin ako tigial sa el sois brasele. Type 2 diabetes abel all Tialo mga leda ul. O mga leda ul mga damo sugal mga damo terakra o mga led adang ngania history gidra sugal elwa ngania adrabli del sugal al ube kada mga dalbo. Sige da kuk risk factor type 2 diabetes. Ngania gestational diabetes. Tirigel modiol emo sugal ereng guk tial hormonal changes sara padengir. Egida momsa that type 2 diabetes. What are we talking about? Type 2 diabetes. So, pelawa symptoms of type 2 diabetes, symptoms of type 2 diabetes or type 2 sugal, ang di mga moom. Di mga moom, may edaranguf, molusa weight, di ka dalangit mga ulma, kadalusa weight, di ka da tangana diet, lusa weight, di nga na kadasongreng, makita o singir, tingling or ngoramo mga normal feeling araigal imam o im ngoramar ngoramar marums madir tabadangem tare alam yo dal mom ups malube mga ngas abay gingarakaw ay gaya symptoms sa type 2 diabetes aksila dagel risk factor type 2 diabetes. Okay, so risk factor type 2 diabetes sukum ko sa bebe ata may hospital at toktang mo kasi pre-diabetes. Pre-diabetes sa sukuma sukalang ma sel tell me about the sukuma sukalang ma ang arba para 125 seguida ko kung na risk factor at diabetes ora ko overweight ora ka regiman na mo para 45 yang kasulodila si adrabli mar sisters rakaw brothers sugal seguida one na risk factor rakaw mo sugal ma Pacific Islanders seguida other bela Pacific Islanders batok nga African American Hispanic Latino Pacific Islanders give ya got the cloa risk factor gidara asukal just because the follower say gidal risk factor Did I discuss this, access to diabetes? So access to diabetes care. Bato ka, so bato ka access and more at yagi the lugura diabetes. Tell me about it. Okay, so access to diabetes ngarinya yagi the gora bato program ara community. Betul program na belul, gimong screener kami, we ceka sukulengi, we suku mengkora malu be kom kora mengkadalbu kom garang, and then lagi refer kami mer hospital. Hospital OPD Monday to Friday, and sabi iwal met mu kada ceka kami. Kom jaka mamura swel club sen mo tutau, sel ome kom dimel register, and then o isolation so mil mem garang so mil met chegar kami kom sugal kom garang ya git chegar o kuira kami and then ko mara toktang ya ku kada adu ai ke gidam le koral sadang kal ni wala mer kamam
Okay, I want to ask you a question. In your statement when you began, your statement, you said as a Pacific Islander, we have a high risk of being a diabetes. Why is that?
There could be a genetic component to it.
Can you repeat again?
A genetic component to it, like your genes can have an effect on that. Not only Pacific Islanders, African Alaskans, being an Indian, being an Asian, being an African American also is a risk factor for diabetes.
Tiel lugar niya toktang asing tiel Pacific Islander ngarar sa ngara jeans rigid.
I don't have any statistics that I can talk about. But according to our elderly people, they say that we didn't have any diabetes as prevalent as these days. Is that true or?
Yes, the local food has been replaced by whatever diet that was influenced with migration, immigration, emigration, and that has very much to do with our risk factor, and also the lifestyle of the old people or the people living before, where they were doing manual labor, they were actually working in the fields, they were actually going for a fishing, and they would be hiking. But now our lifestyle is we use cars for everything. We just go shop and buy our food.
Yes.
Unlike the old people before, even though their diet was kind of the same, they were actually spending all that energy over different kinds of things and by doing a lot of work. But now, because we only eat the food but don't spend it, that's what makes us a high risk for having a diabetes than before.
Wai saya lugar niya toktang asing adra nga ramo ngam lewingil ngalir tadimil nga local food el alta me kada mga yagi del botokal gal nga nga para del Demei makada mga yagi del botokal gal klo sugal ngel ma yero kul maknit teringi edikia da sal mingit tantigal wa nga ramo lewingil exercise kada di maral nga ra ser nga ra el agada diswada el mor en agada oral kada mas aramla el mor so ada ngigel en agada bora kada di mora stowang al mom ar kada mora a vesgel ngel el ultimum ara paras ndigi yamal ngara sers ma o mga leva mal close to talel mora yegi del gal del local
Do you have any statistics that you can share with us?
Currently none. like how many people do access local food, and that's why they don't have, and why people are using food from outside, like easily accessible food, and they have diabetics. For that statistics I don't have.
So are you saying that there has not been any study
Yeah.
that pinpoint that it's the import food that really
Yes,
causes...
food and exercise is one important factor for
Okay.
you to develop diabetes or not. Apart from your genes, that I mean, you can have it in your genes, that could be a risk factor, but you can still beat diabetes with having a good diet and having a good exercise, because with doing an exercise, your skeletal muscle, like the muscles, will develop more opening for insulin, and then the glucose will be accessible to your body and it is spent, so there is no more high blood sugar in your body. Having a diet that does not allow you to absorb all the sugars that you take in, like eating local food like prak and taro, which have high fiber, your sugars will not shoot up as unlike you eat white rice.
Mhm. You mentioned two words that seem to be very important to diabetes, like insulin and
Yes,
glucose.
yes.
Can you explain those?
Insulin is a hormone which will allow the glucose to come into your each individual cell. Okay, only if we have enough insulin, then the gates for the cell will open and will say, okay, glucose, now you can come in and we can utilize you. But having not enough insulin, like in diabetes 1, and having an insulin resistance, though there is insulin, the cell is not accepting that insulin like there is a resistance. It's saying, I don't want to accept you anymore. That's the resistance. So it makes it hard for the cell to get the food for it, and we have the symptoms and the complications of diabetes. Insulin is a hormone and the glucose is the energy that we need.
How do we get more insulin into your body?
Genetically, we cannot change it, but we can reduce the insulin resistance by having good food, having healthy lifestyle.
Any recommendation of particular food that if you consume, it will help you build insulin in your body?
Not really. There is no specific food, but very different kind of foods can actually help you decrease with the insulin resistance. Like margosa can help, okra can help, noni can help. These are the local foods that are available for us and will actually help with us in treating diabetes, or potentially, like you could be a diabetic, but if you eat these certain kinds of food in more often, then it actually can delay the development of diabetes.
Sorry for my ignorance, but do you have any data about the diabetes, the number of diabetes in Palau, and what age group are mostly in that category of diabetes too?
Yeah, we have data, but not available to discuss with you currently.
Okay, so you can continue.
Okay. Any more questions you have regarding how exercise can help, or how diet can help, or how medications can help?
In the first place, I don't like to be diabetes. So.
Yes, yes. So having exercise and following a healthy diet will actually will prevent you from getting diabetes in the first place.
So it's really a lifestyle.
Yeah, diabetes is a lifestyle disease. Just because you're a Pacific Islander, you don't have to get it. If you have a healthy lifestyle and you take a more amount of local food, less amount of processed foods and added sugars in your diet, you actually can beat it.
We didn't see many young people who get diabetes, but nowadays you're talking about
Yes.
kids in elementary
Kids.
school level.
Yes.
but
Yes, kids in elementary school, it's just because of their diet and not having enough exercise.
Is that preventable, or do we need
Yes,
to?
absolutely preventable. That's why we are doing this. It's absolutely preventable. If we switch to foods, take out the processed foods from our diet and eat whatever is available locally and freshly grown, we can absolutely beat diabetes. I mean, we can actually stop the progression from them to become a diabetic.
Wai se yang ka order la bangala Dr. Lala Mayra Bilonyo. So geometer sugal nganya teme la geometer tir every week and 2 times sigma Mr. Tir Tuesday Mother's Day. A numbers to kama mahal na mo klo ars me aram lamin magagare. Len dia kan ngang segi dulu wanya toktang la seng maral ngar om ngalet a chin sergi la ngarngi di sugumang kada hukut makli jalo ngalet lela kada dito dal moras tuang malima soda selwan soda akatala la close sugal ringi and it takes you about 1 hour more burn or sel sugal or selwan soda e kita hindi kaya doral kada di ngaram lain more makarang song maral clog to telel jalo ngalet ulugum kada mongil om ngalet dal momongoy tay kita dalwa marcos ra ngalet so that I believe if you're mangur and mga gagi the local food that 2012 of singing so the other bit sugal
Sugal nga niya, Ruth.
he was asking is there a medication for diabetes.
Yes, there are certain medications for diabetes. We can actually start with tablets, which will increase your insulin resistance and uptake, will allow glucose to come into your body, and that way the sugars can go down. And if this is not enough, like no matter how many tablets you're giving, it's not coming down, then we will add up on the insulin hormone, which is produced on a basis, and then we can give it before food and before lunch and before dinner according to the requirement, which will actually help them to bring down their blood sugars.
I've seen people with their legs being cut and people getting blind,
Yes.
and they say it's a diabetes. So what causes that?
Because your high blood sugar is there, and then that blood sugar is not available to the individual cell because of the low insulin or the insulin resistance. Actually, the cells are dying. Each individual cell is like, I'm hungry, I'm hungry, I'm hungry, and they're dying. Okay, and how we can stop it is increasing the insulin resistance with diet and exercise, and also taking the medications on a proper time and proper according to what the doctor have prescribed, coming to your appointments, keeping following up. And just by taking the medicine, it's not going to help you in anything. It's only like a very minor part of your treatment. Your lifestyle is the major part of the treatment. Some people think that, oh, I'm taking my medicine so I can eat whatever I want. I can do whatever I want. No. It's just the medicine is just an added benefit. What you can do for yourself by following a proper diet and proper lifestyle is the one that is going to help you beat these complications. The reason we want them to start early is because we don't want you to lose your foot. We don't want you to become blind. We don't want you to cut off your foot. This is like you have neglected your sugar levels for years and years, and your cells cannot heal anymore on a natural process because they don't have enough energy. That's when they are rotten and we have to take them off.
Thank you, doctor. Can we have the nurse translate what you've just said? Sabi translate tayo.
Oh, oy. Sim nang again. Bato ka.
Radam lamo
Communication part,
kito
work
singir
with
mal matugori.
Oy, mabatak nga adal. Emral batak nga adal lam makita o singir migo truko oril niwing reng tiatsu ko langir el tingar ba pede kal control da. So tial tingar ba pel sukal ya kal control da gaki dia waya lu ul mong makita o singir. Ya pamola ya ka room, pamola ka room el sel sukum kam lamo sukal manggina mal malaka room. Malaka room segi del toktang akmu ya. Batokal ada sesel sukum ta sugal emral batokal sugal me malimakar edo sadar o ngalir nga senya ka tutelela o ngalir ka nga kamlimakar matiang control sugal nga mral batokal otherwise sigid so close tutelela sukum ka malimakar al direct mo ngila o mangalem el control ra sugal nga mandakal bol makita o senge mamatuko imdakal diligay gidala ang arbabal sugal tomalam tomalagi danirgaw tomala hartargaw tomalagi al magkakarel ngurda al memeteng ay gagid al imam mao maul mang ay gagid al imam mao imel nganyam kakarel ngurda ringi tomalya circulation mang mayaw da oops mayaw da oops ya baigi nga moringi mang mogira dal momaluk amadam direct kalmuira magkakarel ngurda maul mang tomal na madal mo kada momigo. Beto ka tal malela ngar babal sukal mo malgira dal control malal na maptokar at ngar omsil karikit el direct lu ultiar ngar babal sukal so close to tala da control la sukal ngar
Umatiale mur omsil ga direct el sukal ul ndiak dil tirgel matugo rirma kito singir.
Ma direct ngar babal sukal la ul matamo omsil ngar babal sukal la ul mang matamal la heart tir tomora kuk warura of island beto ka tal malel
Brinn ako lang ra Ministry Education. Sabi ko mo rong sit na singarang Ministry Education ngarang marul kire tiar raktel sugal.
Alimalungit tuta. Wuk dungura Ministry of Education nga ka Brinn Demei el Program Manager Food Service Program nga kam start research sa 2014. Igel yuki morura Ministry ko ra support ra Ministry of Health and Human Services sama particularly NCD unit atral waseng makarang the promote healthy eating ra rangal ra school mandira kal sabire lol ngyas kay gidel makital raktal tukunit tal sukal ma yuguk serakot tal soyis bra 2014 gimle eliminate tagel gora canned foods mal maklo sodium ringi waya corn beef and spam was eliminated from the menu digidire kal le provide hot dog magidire kal ulto badray eda kal ngarang ndakal bula sensual that provide and ding nyora wuk agora kigarel batcheteng kaduk mo omes ay gel sa beedel provider sa gidel time maguk timle osnga garingi seraksis bawaseng magarang eda dotop dai gagi del galal guk serakuk kal teme aktir kigare ngal elementary akmilnga me elang guk sa beedel lotop dalim lam mabtoka abek padeng la teal sa beedel smig lu ulimos edel mga ngilgal padeng magil top dai gigi de mo start to promote a healthy eating el direct el collaborate to our local partners waya Taiwan Technical Mission mal migel naman makatek tulong sa mal provide a healthy local fruits and vegetables el mura menu maigay moru le direct el ngiti gagi del cook sel ngaraigal school cafeteria prepare akal magidire ko marula cook workshop al mortira bekal quarter so ngara minimum ng 4 cook workshops sa year el direct lol nga sir tir lol nga sa agora da daw artira rior mang mo sab irel malmol malmarula gagidel healthy food al gim provider a menu ra bekal sils elagi mle o lunch elagi direct ko mo provide breakfast masaya tara agora challenge hindi gimal malas mal provide a healthy eating rabekal sils ra Monday to Friday right now ang ngaringi sel oral policy gora dekal written policy ding seraksis begadam lamo ospe erngi leng tel NCD crisis ra blur vela قدقورا ملي work لبن ترير لبن جلا NCD unit الملاس ملوسي مغران the help eliminate تجاجيد المكيت الغالة ما يلوم را school من الالتام من دقا اجي promote healthy snacks المورا را school سل البقل school لانغارنيا جل اريل واسيست ارنغال school سل مي سل تملا for example a recess انجيري المغا healthy snacks ندغ الغرة دي جل مكيت الغال لما سل جوكل تملا lunch ما breakfast اجي di provide aral ma namo dagi ngara mo rakngar elementary ma mar high school lagi di mali mat choose isa ba mali mar Monday to Friday di alam la mo dagi provide dagi del fruit juice mang mal di healthy snacks ra recess time ma igel guk tagal temela lunch ya igel guk temela blongura school and water only el altama gi baim la mo provide a meal sel guk kol gorang nga ate ala gi promote agi dire kal continue work towards a healthy nutrition policy raigal school ese obengela NCD unit agi mla start raw era covid emna nya consultant al mail dire kalorelo bang kamamal el implementer sel student nutrition and wellness standard ese awal gora klol policy le mandaira dra olbi lel mail wasengiri wal momru legagi del policy not only more public schools, direct more private schools. El waseng magarang about the promote healthy nutrition, ma active lifestyle el more ngal school. Ese ya koteklo tutrel el bolo dangalil aware ngi rabe kalsils en help lol ngaya sa kartel te alela sugal el more badingir. Ma ukurati samri ra food service program ma gelgi morul. Sirak start in 2016 nagim lo start el malara nutritionist. الميل ميرال أوريو لبنغ مامرا Ministry of Education الhelp provide mostly nutrition education المورا أرنياسغا تيجي الرغول ngara elementary school ما pala high school right now ngara 2,260 public schools students ngara elementary ma pala high school so mal klo amount rar ngayasga erbela wagim surbertit matiragi the nutrition educator sang artyang alwana ngarat na chaika right now nutritionist chagot subura dire kal ngarnya Xiang Huang ngara ICDF Taiwan dire kal me tegi da last year ngir elang ding mal maring loader mengagi dal ngara Palau High School elang al marura nutrition and food education loban three are business class students guktra lomestri raigel gora nutrition education ma nutritional knowledge lo spe el gora brainstorm el pong magarang al redesign ra sel gagarel stowang artil el ngara campus etil gadre kal ngaringi segi del gagarel stowang artil el gora mora tigel business class students el masub el pong magarang kor orurta shobay at the same time engira del promote healthy eating eleng al sela campus kama ma provide a healthy gal al mora cafeteria el promoter segi del healthy eating ra school breakfast and lunch so tigegi dia angel ngara chaiga nutritionist 2 years every 2 years agi wuk malartir ngel ICDF Taiwan era bekal ra agi request malartir so el alsil sa tatul nutritionist oryo lo bangger al marulay agi del food education ra schools el morte agi rogul elementary mapalaw high school dire kalma lungil at dire kal ngasel or ngasel nga kalmaru la cook workshop el morte gal cook sa gal public schools tiria design ra menu ra public elementary schools ma high school tadire kalmaral el bekal mandal inspect gal school kitchens and cafeterias make sure en rogul toga dingil maral SBL pasa inspection ngila ar cook sa dire kal ngarinya food handler certir bere Dorcas sa cook mo so di say sel bolos others sel promote ay gigi del gora healthy eating guidelines mga rang dire kal food service program amrura monthly newsletter el gora o mastrirar tigalgu ma iga principal sa iga school ma within the ministry lo ay sa igel gora health promotion algi morura bekal buil esel gora ma highlight rama ma sera May 11 ya president tra Blue Bella ma tigel minister seringi amle visit tra cafeteria ra Church P. Harris Elementary School. Igor amlo ome saigel gora tele la table top gardening el loru ra school esel arangal gadire kalmam tamasu vertel tele la lomgaro legal dalom le togonigel yasa el provide esel bon maklo eto harvest de ola bal merau memru le mortal lunch program. So dire kalman le gora ama otingi selen through ra igay the collaboration the lobantri ra igay tiga local partners Taiwan Technical Mission ma direkal NRFC Northern Reef Fisheries Cooperation ma Bofi Belao Offshore Fisheries Inc. Kaya gi tral promote local eating al Meregal School. Mambek kalboy lagi temor nga teli rangal kal mga nga akugaw malubeng diokang ang amuti ngigel kukngarngil onral mangartal odoy ma el dollar ngira ko up ma wapofi ya TTM kukol nga sergi dilo maski da local yasay ma fruits mang tirakal gora tok tigay gidem ne okya kal nersel me inem ne gora lam asaran diling tamil nga for fruits at tamil nga dragon fruit makwabang ega tirakal el altaming because of fruit flies na mo da kada west arbor velaw ako taswakan mga kwabang ina mo maring nakalwang aramo dito drama kas sevel el ipni aro de mga ringi mang tadirakal saragi mang ko provide dragon fruit ma kwabang en arangal matam asaran ringi hindi ka kalongal kal mang saragi mo ko ma provide raskura mayun set ngarngal kal mongoit agi mo le tokora set tiang rang mal yundong malungil labadenge le malgora kadi mesa ng sa mo ormi tatirin mga ringi hindi ka katalong ringi. So, ega nga maring ila aral dire kal jakad afford restowang. Mang segi del teleta elwase agi promote healthy eating, collaborate with our stakeholders, make sure healthy eating ma healthy lifestyle agi promote ringi raigal public schools. So, gimal blakarang ma may work with the NCD unit including our Ministry of Health and Human Services, lo si gaigel te al elwase. Magaranga the promote agi del ma school marangal geda mo mga nga ang ilgal ma Robert Tegi del Rak tamandiagal libertir el al dirgal magigal ngal kam mabol maklol ab so say agi ko mo ra maruringi ra igal school sa man sular te al.
I just want to add on something on this. The Ministry of Education is doing a very good job in promoting healthy lifestyle, but it is also the responsibility of the parents,
Yes.
the grandparents, the foster parents, or the guardians of the the students, to provide them a healthy lifestyle, to enforce it, because whatever they are doing at school, it's better if they follow the same thing at the house.
Yes, and that's bulk of the idea of what we're doing for school lunch and breakfast program is that we want to promote healthy eating, and at the same time, we always when we conduct this nutrition education to all the schools, we tell the kids, please learn all this that you can about nutrition education and go to the household, go to your parents, go to your family and share with them the importance of healthy eating. Because it's we're providing it at the school setting, but unless the family setting starts it,
Yes.
it's gonna be hard. So
Yes.
we're also enticing the kids to entice the parents to
Yes.
come on board and help us with this healthy eating and healthy lifestyle promotion. So not only our nutrition education nutritionists in the ministry are not only conducting nutrition education for the schools, but they're also going out to the community and partnering up with the NCD unit, and they go around and conduct community outreach programs, which involves checking your diabetes insulin levels, at the same time promoting healthy eating
Yes.
through cooking demonstration. And that's mostly to help with the parents, make sure that they eat healthy as well and teach their kids as well. So sel ko raklo tutela lelgire la nutrition education regal school la wasem dagal agi malas malmalgor tiga nutritionist la wasem mol nga sewertir mod mastiri raungi luldas wel mortigal ngal galgire la healthy eating ma healthy lifestyle at the same time helper tiril gora all tersel ideal wasay ay gang ngil rabadenge the masel bora masel obombre e kum ku kol sis aklar our parents malubay gel silu bal ligara cooking demonstration aguk mol nga sewel lo mastiri our parents el wasay gagi da guk gimonga nga school mel tang sab edel guk momanga nga rablay e guk kay nga sewer say gidulta sul wasay makarang nga promoter tel healthy lifestyle ra ndakal dil nga school madre kalmera a household ra blue pelaw
Sila Brinn mentioned tilale ngaramom na niya adulong ra tege del food program. Nga mil nga daw ni rata time girela tege del isura food service.
ay sir
Temlom tigerit na say ang algara East Coast ra desperal amal klol festival sa longan.
oy
Hindi sen ngul mo agyuk lan di sorin mga tela ngigel. Odoy medat soria festivals. Tirgam lo mutang igel ko na sori tirgal nga.
ay sir
Tamlo ko na survey tir tamlo aragel provide agel tira sorin mangaling. Ela tagi del guk moru nging. Ngari ako na survey ng conductor ngil. Logera ngal guk mong rabel oil ko na longa rablirir ma logera te prefer ngil.
oy
Lokal.
Jakula baigel information el girel ndi tigal nutritionista dira kalmrula fa surveys food surveys particularly in Morangal High School madira kalngal elementary lukor ogya retil mo nga somil kalan mga nga somil yasay kam lister kama maigel fruits and vegetables and somil mga rabecal seeds nga yasay ma fruits sa omutangay giwuk may gigi del me ora msuba o mesel wase ong tangaral school mal sorry ray gagi the meda provider tir makuk ngaral school agora sorry ray gagi di sel kwa sa pegal lol alter nya wase seragi mo tag starting malmle seragi mo start promote tagi del healthy eating ra school sing ngora wable close sel wase dagim daka sama mal mga ay katanga mal mga atima mal mga ya tigal nutritionista mom tadira kal absorbe o mes take notes eme gi wuktaral improve at mong makarang agi mol nga sir segi del teletal through a full education ra igal classroom e dire kal mo sa share information ng mga parents mo sa ilom aray gay del yasay di sel ko tulungin el gora sa edel subi wasing tam le start dim la lo ngay el al blabo lo ngay et tam la mo sa ilan mga ese ako tatlo to tele lagi mal promote local fruits and vegetables sa menu leng ay gaya ngaring irigid bato kalbek padengel sa edel provide save kuk nga the saver about chetering mang ay gaya gim provider et ang tira wal blabol tanamos mawal mga mla mo da kalsan mal close el warafa wal iyital el gal mlewaya walel say ako tal wara klol giblam take note ngil mong taraw ngil teletal giblam subil wasay tamle etiri matamlek lo ay tele lang lamo sabil mga ngi mang lamo ge kare ay trakal esaya close to tele
Yung ito ta ko nga raer.
Oy, malungit tuta de kor ka budulong. Malungit tuta ule kor tilal abro hospital rogui. Malungit piat program ra LCD. Ay se do reng se pia. Kada blaka ngara prevention ra ko mesel kami ko blaka rong mi promote ra a healthy lifestyle ra. Arngal ra school ma arogul agel belaw. Pia ser ko mesel ngi problem ra blue belaw. Yang wado ngelia men el problem dia kan bo ror gidel imol budul mo resolve pia gidel important klar outside el metmu lu udang ngarngia LCD la man namo highest percent tral ar belaw merko di meras men di gidel el prevent ta program ay gidel health lifestyle gid el diagbo sel manal men el solution el gidel gut makti en resolve tiagi el to LCD at selveraw tiagi tul option even en di marala igat klal el may the go spare business or try igat klal at taxel on sa kabelmen kada ma sugo di mol metro will da ban el di mol may igat klal mo nga aran morwap bola kala aran bola kan sugin maar de ulog ay intentral la do rugi o se di ong liwer nga aran morwap mal ad bola ka bod Loruta malu ela al bolo maaral me elospe. Betiagira men solution. Kila other al sins. Kila ri o misinder gila ulogora factory food. Igagi del gen food marogul mrura factory. Kaya bral bertijer niya berul aber al sins wasay. Al atim man soam al sins abimandra supplier sang song sera. Tigal a supplier sang song sakmula 3% to 2%. Rablulaf. Igagi rogul. Len May del gil ospera al setial bulu aber al sins. Abay di taronel tolong itro di la gura kasi mo mesra la ay gagi del botogol ular tira other vela di imrula kamel di el amak guguk rom madogol may gagi del makitel gen fudma akal like outside del metbu podol ngay asa emergo tur na gida lokal si momrula sales may gagi del kale del donga legal bere da adi del gida del mga galgal kan na amoy tem nga kali rubli ulo di sa oral imol bulu kom sulang may iga
Mga ulit and selling sila comment.
Malungin suggestion.
Kapo Dorcas segup mo ay sa gelong at mokla Ministry of Health and Human Services el gireltia.
Miltuta Mr. Talam se aktimo o giwilir tirga ngal oisoy sa Egel Blandung. Egel Blandung Dr. Sundara. Ayga yabla kardalel selse arseldo o tasa ringing ayga gidagel symptoms maigel living gos ringi en mlayu idangal nurse e dire kan gagi del other education en mlamok muigel ilgu kloru lerasku le malungi larungu del public health dire gal mal batoka loru lel girel osab aklel malubeng prevention rar adal mosme yalak alwi da ngal tokta nga girel madengel wase about 80% rar other belar el all time between 70 and 80% rar other belar el all time al amlamo pre-diabetes mar diabetes type 1 diabetes type 2 diabetes oy mang el aigal giguk moru public health agi nga ka kuk ngarisel primary role nga kal moru legal food handling certification Selmer adra magit, tamar adra aurora restaurant, tama tirigal rogo food handlers involved with food and drink preparation or telbalu. Engiril me agi modong okle adadu. Esma daigel rogo il gora ungil teletail el gimgat lagat maklisel otrul. Endiakal al usmria ngidil contamination okya ka malamol mulungila heldringi okya ka at the same time. Mang Ndimle imol tokora food safety gul saudringi esera 2015 rabodol aswar belaw luaseng mlasoy seperti del clowl garriol girela NCD matadim logay makmadar adara almost every day public health ul sisbi selguk tigingel healthy eating guideline el mosob aklingel el food handler mang mamadu el sob akli selgal ratigingel abayging aigel 3 contaminants Maria biological, physical, and chemical contamination. O sisabi selguk tigingel healthy eating. Manggakut maklital ka landigal ingredients sangguk mlongrang klel. Kadimil erar tel garbol kan sumirastongan gulme o sa klilo banggel at tamanenging malmasterar okyak. Also kumungwaisang adyakal healthy. Mang ay sige diatara kuru ringil seleme adra magit te kami amdengel wasa adra magit el alta maragul food handler sa mlarutia with el telail mewal dart al disir el mga tmok lakale el alta malul di mo kortit trigel self employed sige diatara aquí moru ringil self timer el anga mulwasay access to diabetes care logi omsub say atimer el arra kara World Diabetes Day mang imor agi moru ringir el public health way say del blal deliar other education Brinn el wasay tirgal nutritionist team up lo bangela NCD ma Taiwan TTM at Chaika agi dirgal marail reach out el mora community
olsis akartira healthy eating guideline maigel mal bayote simple el tele la doru lagale del yasay el matter of 15 minutes 20 minutes sa mangaringi ang ma vitamins ma nutrients sa alsel batya nga outreach program ligay del klawal el adat makal maruringi el maliwek kartel balur belaw imoragi moruringi selgi mamukatangin mula say diabetes prevention program TPP class el say agi moral el raigal balul dire kal gora wagi mo aisrar balul wasay may matadakal gora masub el mom ngel wasetial tagingel asugal magarangal sukum kamlo kamla morsel border kamarang terbengir sayid mal uban dir ka borsel border kamarang terbengir mala ka bom sera sugal sayid del tigingela adi pipi kiblam moruringil direk ngariar mlak graduate abelura irai beluring esar belura iwal belurang artmau mabelur oreor tia gimulmul moruringil sera 2018 mang LL time mang mlalmu taltmau tangariar adara obisra Red Cross angartegi del DPP class sel dia au aklung el tegi del DPP class adia gidi mosadra tigingela sugal el margong leng a health dargida sel overall health amlut kelgira la mental physical mental emotion spiritual and social ay kita claim melut kel tokol gira la health esel suku meng dia ka adal asab el maldita oda kay rogoy ul mengira del moral merula ay del gor outreach educational lol sis akrar adal wasay ay kita gel el toil sel doru le lendal sel dinga kay ngarabli ke mititu nga al may kay kita rogoy el overall health makata makarang ato adoral el live long el live healthy dire kal ngosutri arbeklat mang tiage del DPP el asel gi mobile maral masaw dringi ya gi moruti ungil eliway wa ungil langur ungil undo makarato kora mangoy taigel monday rakaw lagi da tibek kelsil sejel di seluruh monday ya gay kita rokul blaktung ay gay al suku mangari rakaw endire kal sabel malklot el lot mataw el mosukal lengarang ngorawal ngati iya chemistry dapat ngem nga kita toktang ang artem sa el mutul mo repeat ringi baka kukmal may misel ako kukmal mo kasi barngum eng ko somel ko di mangal kang edi imelameli men somel to dal mora out del mora arili ba stress rakaw mo kamel may romel el at the end ko fight mo accident tay gid roko ya I'm sure other ko dim bengay masay gid yatra gi moru ringi tigeng la di pipi e direct kal ngari nga igel dadul wasay program el melut kal gira lagay gid el overall health ngari ni sel tora hives exercise ma zumba swimming ngari nga activity la swimming ma el alta mangaring ingel radira siabal el andara chegal dire lo mangamam loreor inge maru resay del gora exercise ra el morar magiklow at adal people er selo bisrar ma uodal la mostatra manday masel hit ma dire el sela hospital el ang ngaring igel lunch and learn leng dire kal tiang ate gidim goringin morar belung mar beklad dire kal alsama gi dire kal selgi bom stress yagi ngui makohi ek ma pizza ek ma donuts batoka yagi del rabatamel giramel dire close pe agasul girel magi merur segi del lunch and learn sel mo mangora atara activity ako rati soma melo ay sel mora while wasay el atel belur orera ngani ay sidewalks mang sabi adal exercise ya bod exercise la ka kukti moru rahel darakam el markong molker sa elim mar our family member kay mo exercise safe, eat safe. Ma kumda soy gay gel kuk kora imala public health el lodar selmora buay mang aktira kalmal lo lingitrar balul wasay mrang si say gid el tiging el adi pipi en mara regal bek kalbalu malakal timil mer el aldir el tada le lora el mong en mo oral el agi maldir kamara el murungil tabal lo mer gartel isela tiging el asugal akum da say gid el black tungal ako rawyal el tiging el agel gi morular adra public health el nganya question sabi ul ask kata bay adu lenga kita tok takal ngartia mabrin komsulang
Gora World Diabetes Day. What word again you say that our audience and listeners can take to heart that they need to change their behavior and eating habits and
just follow the theme.
I would say like you should eat healthy and eat local, be more active. If you are a diagnosed diabetic, take your medications on time. But we should look into, oh, when it comes, then I will take. No, you can prevent it actually with how you think, what you eat, what you drink, what you put in your body. Avoid alcohol, avoid tobacco, get active, stay active with your family, involve in family activities, and eat local and healthy. That can prevent you from getting diabetes. If you get diabetes, seek medical help, get your medications on time, come to your clinics, and then do the follow-up also. You don't have to be depressed or you don't have to be sad just because you can be a diabetic. You can actually beat it with your lifestyle.
Brinn, luay sagel program activities blaro la school. Ngara gora tigyan mel sebe mun moral parents loreng setia program gereltian. Program moru ringira food service.
I guess kora diwan lontigal mo na parents awase dol mol mal ertegi dalul dasra healthy eating ma healthy lifestyle dosis akrang algeda algire la healthy eating leng agidire kalmal plakaram mara school al marulerni ndi kukol return na lego rabla la kalorul mal ube kukti donga ngaigel sawad toli maigel sawad eng direkal ngorawal itatur segi dalul dasra healthy lifestyle promotion ma dokora doling itet mo takay nga sewer tiang etya dakal dil gora tamatal ada o mga tmoklaringi lulil mongil ngi del bekla ada kay nga sewer lulil mongil ma komsulang raigel gora kuk modenge el sabi wel share lo 23 nga ligiw marang school lol nga sertir tagi del ultasol gire la healthy lifestyle ma healthy eating rabekal silsa komsulang
Sebed mong kalgole. Kikole ngara air.
Kalsuko mang pangil tutaw. Kalsuko masuko lang nga 6 point. Siyang Ali? Hello? Ali?
Oy, ngara air.
Kalsuko masuko lang nga 6.0. Siyang border ang gaya memle makar ka makarang.
You're still a pre-diabetic, but with your lifestyle and the way you eat, you can still never be on medication. I am a pre-diabetic myself. My HbA1c was 6.1 2 years ago, but with improved exercise, eating healthy food and more of brown rice, I could keep it under control. I don't have to use medications.
Sulan mong kalgole. Okay, milto takole ngara air en sebem loge ragri menge enser el momre kan ngani agri mekel mut loge. Okay. Kabong.
Malungo tutaw.
mora toktang ngerti lang. Ngaka agita malu kalwil programa moruni malwil program lingrela askulel belau mana belau. Hindi komla rulia. Komna tsikar belau kung si tial belau di hai. Dia kalau di hai plan di ha sukal di kalau sukal. Komur mul di girela hai mengka prevent travel mo ha sukal ringi engkal lo ukmul mat. Lekom nam sakal girela lo. Engkau luas sugar ni, sekitar kosim baringi. Saya mengerat retele. Asum dah mengenai saya mutul yang melek tawa, kiri kurang muah, jam understand.
Dajjave kole kahalet bisteriati alel enser.
We're only talking about the high blood sugar. More about the
Explain that.
I did not understand the question. What's it? Why you have?
you have a statistic for
Or
the blood
such
sugar.
I guess the
Palau
question
or
is,
in
Yeah.
diabetes.
In-
Okay, if you are overdosing the medication,
No about medication.
not about medication.
the question is, you're only concerned about people with high diabetes.
Yes.
What do you do with the low? Those people with low diabetes or no sugar at all?
That is a rare thing in Palau, because if they are low sugar, that means they have too much insulin. They have a disorder in their pancreas. Pancreas is an organ in our body which is producing the insulin. If it is only producing too much insulin and making the sugar go very low, then you can have hypoglycemia, what we call.
Hypoglycemia.
But to have that pancreatic disorder, it's a very small thing in a population
But then we do have with those people
who are not taking food enough.
Adel nga kukya lola kan mga ang ding mo liya sukolingi na di mal prepta. We have people here. Tirigagi del way sigid ang anya te klo at te eli rangan mother time al mosugal al di lol mol di matakak ka longo ti. So I know ka akmadan tira but to kal adel ngaramo
So
nga
it's already
nga di pasugal nga di pasugal nga matadi malima margos mga margos serap tasugal ang momri nga laptalu me momri talaga gidel symptoms. And then later on in the telal years from now etam na mo sugal los pe akar.
Because it's a disorder of the pancreas is what is causing the sukal, either low or high.
So seta na patengin na sugal. Tirigen malbrep tasugal ngir.
Kami aman misulang ko la timiyatam nung nga niya ko sumilumutit mo era po tom simil.
Activities in
Oh. Hello.
Is it okay if I
Yeah, go ahead. Go ahead. Yes.
Okay. Oy, elang kama maulagim le Mr. Telam sa atimel me ko ram sa tel sugal lende kal ngarang World Diabetes Day sil seringi se November 14 and go tulurera next week mangmo ngaringi ako ra kom amo omes ako ra patokol sign na ma rangal kara school ma activity ngaringi ramadan la pisisilul dimok regal baby rabelu oy belal November 11 na en ang November 11 na 4 to 5 p.m. en ngaringa tirgal ngal kara school mo re kada gay del sign al ngarat kulara ngaringa ngal kara PHS marangal kara EBHS PMA MHS ma abi MHS itirga ngadi moto kom amo masteril di mo regal kulara el gora o basay del lola bagay del sign esel guk November 14 between 5 and 6 yung moring isel dadul wasay walk run lomu uram da la PCC also mo mo ramara rara le me ang la PCC mo ra isngek lengarnya banner el al talarak lama ko ra all hotel tagi del silsra World Diabetes Day tiam la mo
If you still have more comments, you can.
So ngau era halabay baktu tikinga kamukpok mare kamasel bobot tira ngel ball closer ngi mang sel ngari sel tarager el mlora other education el giri rangal el aigel kukurera mara public health agora bagiti mogot odu orar food handlers endi domes statistiker el anget tokol ngal gra elementary school adire el malmlamo obis ya obis ali derga ul mora ya gidel agel dul waseng for el maklol NCD rablu belal ngania heart problem ya ngari agel maklol big four ngania heart problem cancer diabetes misal el respiratory disease oy ya de rogo ya ola ba de lolgo toktang lo seng mom fe lagi de nirgi de ma ya rogo organ sera batenge el ang ya ngal kra school malungil le tomong mai de lungil blungur ra school le other education oral lo bantri ra other school muru lo tabsul blungur disel ko observation ergit sel de bera community ya ngal ga ba isel bera blai etora telgi bel drift away matam asta telgora di mangarwa pizza celebrate burdel mga maklolge ma sweet ma ice cream mang abay gor ongi tak nga ka kora suggest lo say agi akuk tiblol di mga adu urtirgay gidel adra magi telgora migi klolat mang makarang abo da sabe edel dire kaloreng sa other education madot tuti say gidel ungil tabsul blungur school patabera blay obla bera class nga mamreng sa sel tabasul blungur sel healthy plate makarang ako tira kaldo tutira blay o ya ro gulgal lot tangari ara mula sa imported food makit mangara no aro gulgal la diungil dingira dal mga ngal klabel giral may sure da engia sabe mel dia ko bom sisbray kay dudula say pick 4 NCD ra balur belaw akum da sandin mlay kay kita so kalsier maula la ekonomi if you wanna say more kung ekom sulang Mr. Telang
okay, so akadi mo mutul malakol mo OPV sabi iwal mera bektal sil sa Monday to Friday from 2 taon makopstangera 4 make sure la sa ko mong so mi checkar sa iyo and sa iyo fast as well rakabsel mo 2 taw edi met mula seng sama mal check la sa ki sugal lagi makarang yagi ko checkar kya rogur res malakam sugal yang ungil lor ungil every year ko pemsi sa pem checkar sa iyo la ka dita ngara balu we dita ansinger gi de la ka check ngarange and then moral mer hospital na mo dia ka sa edel mga tmoker kami ada